Yeah, no one told me.
Already. Yeah, there's white and chocolate. Right. Maybe I gotta get it now. That's what I'm doing right now. She was supposed to be here.
Yeah, he said he'll be right back.
He in church, sir. How's my little finger?
All right, welcome to the Innovation Team's first Cupcakes and Conversations, a series of intimate discussions meant to educate, empower, delight, and inspire the wonderful individuals who choose to work in Shelby County government. I am Danielle Inez, the Director of Innovation, and today's event is the brainchild of the I-Team women, Marcina Yedeby, Jennifer Sharp, and Tamisha Edwards, who wanted to take one more proactive step in Shelby County government's quest to eliminate late-stage diagnosis of breast cancer in the lives of women, and occasionally men, we love. I want to first shout out Aura Sheard, Aura Applewhite Sheard, is that right? Did I make that up? Our Employee Activities Coordinator in the Human Resources Office for leading programs throughout this month to help reduce the impact of breast cancer on our employees and families. I also want to shout out the HR benefits team, including Ms. Brenda Green and Elise Caudell, for taking proactive steps to bring mobile mammograms right to our employees so you could step outside and potentially save your life. And finally, I want to shout out the Shelby County Health Department's 10-Care breast cancer screening program, ably led by Leilani Spence, who made sure that we had information for you all to take with you when you leave today. Y'all, these conversations are important. So in a moment, I'm going to join all of you, and I'm going to listen to a wonderful conversation featuring two dynamic experts in the field. But first, I'm going to introduce my friend, professional colleague, and a public servant who always sets out to say yes. Today's facilitator is Janet Lowe, the Manager of Community Partnerships for the Division of Community Services. In her daily public service, Janet serves as a connector between residents and government services when people need them most. She's also a connector between over 100 nonprofit partners and the most collaborative administration in Shelby County history. And today, she's a connector between all of us and the breast cancer education that just might save someone's life. So with that, I present Janet Lowe, and she'll take things from here.
Thank you so much, Director Inez, Mayor Harris, and the incredible innovation team. It's incredible to choose this as the first topic to kick off this wonderful series that you're going to have. And it's clear that everyone here also believes that this is an important topic based on the showing of incredible faces and all the pink in this room. I am Janet Lowe. I am not in healthcare, but I am a woman, and I am an employee, and I have to be honest with you, I delayed my screening. I blamed COVID, but let's be honest, it was just laziness. And thanks to the prodding of a friend and colleague and breast cancer survivor, Amber Hamilton, she had encouraged me to go and get it done. And so last week, timely, because it came at the same time that the innovation team asked me to do this, I had my mammogram. And I am happy to report that it was very quick. It was very painless, and I'm negative. And that's why I'm here. I'm here to, but thank you. But I'm here to ask the questions so that all of you prioritize your health, and all of you think about detection and care and become fearless and empowered to prioritize your health and not do what I did. And I am here with the real experts, Drs. Carlisha Whitlow and Dr. Michelle Taylor. Dr. Carlisha Whitlow is with the Women's Physicians Group. She specializes in obstetrics and gynecology and family health and hospice care. Thank you for being here.
Thank you for having me.
Dr. Michelle Taylor in this room really needs no introduction as the director of our incredible health department. On top of all of her wealth experiences, I hear you are also a survivor of breast cancer. Thank you both for being here. We have, a limited amount of time, so I'm just gonna get right into it. I would love to ask Dr. Taylor, there's pink everywhere and ribbons everywhere, but let's just start off with what is breast cancer and is it really common?
Oh, wow. Great question. So breast cancer is basically a cancer that's usually found in the breast or in the tissues of the breast. Cancer itself is just rapidly dividing cells, but the issue is that those rapidly dividing cells get in the way of other things wherever the cancer is. So in this case, breast cancer is those rapidly dividing cells within the breast. And I'm sure Dr. Whitlow probably could give even more detail, but that's the quick and dirty of it. Yeah.
So I think some people can sometimes be scared of clinics and hospitals and diagnostics and screenings, all of that, or they feel like maybe it'll just never happen to them. Dr. Whitlow, can you talk to us a little bit about what screening is and what it looks and feels like?
So I'm not of age to have had a mammogram, but technology and innovation has changed quite a bit. Can you hear me? Has changed quite a bit. So mammograms at one point used to be very painful, is what my understanding was. And now
They are close to painless. They are uncomfortable, of course, because you're compressing the breast. But they are very close to being painless, and you'll feel that discomfort, but it's quick. It's not something that's gonna take 30 minutes. It's a very quick procedure, and once the procedure is completed, the professional radiologist will review them and send it to your provider, and if something comes back abnormal, we act on what the abnormality is. What was your next question?
Well, I'm glad you brought up the abnormality, because I think that that's something that, you know, people can hear about. I know that in my case, I once got a letter saying I had dense breast tissue. What does that mean, and what's the difference between a mammogram and an ultrasound?
So, and the imaging is different. How clear you can see what you're seeing. So for instance, if you see a mass on a mammogram, the mass, you may not be able to distinguish whether it's a cyst or if it's like a non-cancerous tumor or if it is cancer. An ultrasound will be able to get a closer look at that area and determine what it is specifically. And in the event that the ultrasound can't differentiate what it is, then we move forward with an MRI, which is looking at a closer look at the breast. So there are different types of breast images, and then also based on your age, kind of determines where we start. For instance, if a 22-year-old comes in and she has a breast lump or breast pain or discharge from the breast, we would start probably with an ultrasound and then progress with testing. But I know one of the other things that can hinder patients from a mammogram, you didn't ask me this, but radiation. People will say, I don't want to get a mammogram because I don't want to be exposed to radiation, not knowing that the radiation is low with the imaging itself. So I just want to clear that because it's one of those common myths that people think that it's high radiation, so they're fearful of it because of it.
I'm so glad that also you described a lump and feeling a mass. What about at-home detection? Are there sort of self-exams that we should be using?
Absolutely. So you can do a self-breast exam. Men and women should do breast exams on themselves every month. And a menopausal woman, I tell patients to pick the day that your birthday is. So if your birthday is on the 1st, pick the 1st of the month. Every month on the 1st, you do your breast exam. You can do your breast exam lying flat. You can do it sitting up. You can do it in the shower. If you do it in the shower, I always tell patients to turn around so that their body isn't facing the head of the shower. But you do it either of those ways, and you're feeling the entire breast, including under your arm, to make sure that you don't feel any lumps and bumps, because you can feel things here that could be cancerous or non-cancerous, just like you can feel something on your actual breast.
So Dr. Taylor, you are both a physician and a survivor. If someone gets positive for breast cancer, they're finding something in their breast, what treatment options are there, and what does that look and feel like?
So there can be any number of things. I'm gonna try not to flub this. I'll talk about my treatment options because I feel comfortable doing that. Not everybody does. And so I always remind people who are counseling people who have just gotten a diagnosis but they've never been through it. You always need to respect whatever decision that person makes. So for me, I actually made my decision long before I had a diagnosis, because I have a family history of breast cancer. My mom is a survivor. She was actually diagnosed when I was pregnant with my youngest child, when I was working at Shelby County Health Department the first time. And before her, my mom's identical twin sister passed from complications from breast cancer at the age of 34. So we actually had a deep family history. She passed in 1990. I was 14. My mom was 34. And it was tough. As you can imagine, they were true identical twins. They looked alike, they sounded alike, all of it. And it was devastating for our family. Fast forward to when I was in med school, because I had that lived experience, I just felt like breast cancer was death sentence, because in my family, that's what it had been. And I had a really good friend, Melissa Borthwick, who was a fellow med student. If she was here, I'm sure she's just as fiery as she was then, just bright red hair, and just very feisty. Well, she shared with me one day at lunch that her mother had been diagnosed with breast cancer. And I just became completely apologetic. I was near tears. And she finally looked at me. She was like, why are you getting so upset? And I was like, because you just told me your mother has breast cancer. And her father was a physician, full disclosure. And she said, please, my mother is fine. She, it was caught early. She had a double mastectomy with reconstruction. I'll try not to be too crude with this group, but I tend to be more transparent than most when it comes to breast cancer. So these are exact words from her. She was like, my mom is going to have perky breasts for the rest of her life because she gets to have them redone every 10 years. What is wrong with you? And then as if on cue, her mom comes into the cafeteria and I see this lady looking vibrant. She's got some overalls on because I went to East Tennessee State University. And so she had been out in her garden. She was there to visit her husband who was working in the hospital. And so she figured she saw Melissa and I sitting in the cafeteria. She'd come wait. And so it was just a totally different picture of breast cancer than what I had grown up with. And so after that, and learning more from her about her mother's process, I always said, my mom and I both knew that we were at increased risk. I had had screening mammograms before, younger, for lumps that were found and all of that. And so I always knew that if it happened to me, I would have a double mastectomy with reconstruction and then whatever else the doctor said I had to have, whether it was chemotherapy, radiation, or the like. For me, they did not opt to give me radiation. I had chemotherapy. I did 4 courses of chemotherapy over the summer of 2016 with Taxotere and Cytoxan. I would not wish chemotherapy on my worst enemy. It's awful. And the drugs that I had were not as toxic as some of the ones they could have given me, given that my diagnosis was at age 40. My oncologist wanted to do stronger drugs. He wanted to do adriamycin, which is kind of gold standard for somebody who is, as young as 40 getting breast cancer. And because, like you said, I need no introduction, because I'm Michelle Taylor and Dr. Taylor, and now my co-parent, but my husband at the time, also a physician, also, a radiologist, we both were like, I don't know that I need that. Right. And so we talked him into doing another tailored test, an oncotype. And so he fought back and said, okay, you two, if this oncotype comes back this number, then she has to get the stronger drug. But if it comes back less than this number, then we'll do something a little bit milder. And it came back less. And I got to tailor my treatment at least a little bit. But like I said, chemotherapy is no joke. I mean, people who knew me in the health department before, I had all of this hair, but it was straight. All of it came out. I knew it would. I had the benefit of understanding what treatment was going to be like just because of my profession, but it does not make it any easier when it's you. And I think somebody said, you never think it's going to be you until it is. And then you wake up one morning after that first treatment, and I had already asked, okay, how many weeks is it going to be after the first treatment before my hair starts coming out? And she said, oh, it's going to be 2 weeks to the day is usually what people see. And so what I did was, my hair was long. I went to my stylist. I had never worn my hair short. She cut it short. So there's pictures of me, those of you all who are my Facebook friends, there's pictures of me when I went and got that first haircut. And then I just waited for my hair to come out. And 2 weeks to the day, I woke up, I ran my hand through my hair in the morning, and it was all in my hand. And then my stylist and I, she had been doing my hair since I was 16. She already knew. She said, as soon as it starts coming out in bunches, because she had dealt with women before, she said, call me, come up to the shop, and I'm just going to shave it off. And that's what we did. And then I got to sport my bald head in the Memphis summer for several months. I'm sorry, that was an extra long answer.
No.
That also is classic Dr.
decided to have a double mastectomy. There are patients that decide and are blessed enough to only have to have a lumpectomy, where they take out just the lump. So that goes to show that it doesn't look the same for everyone across the board as far as what treatment looks like. Some people you'll look at them and you don't know that they had breast cancer because of the type of treatment that they had. So you don't want that to be a deterrent as to, I don't want to get a mammogram because I don't want to have cancer because I don't want my breast chopped off. Well, that may not be the case. Let's go back. You do want to know if you have breast cancer because breast cancer can spread like any other cancer. So when you get to that point where treatment is actually a topic of discussion, then what's appropriate will be recommended. And if it's just removing the lump, they remove the lump. If not, then you want to do what's going to save your life at the end of the day.
That's exactly right. And my surgical oncologist, Dr. Berry, was excellent.
Awesome.
Yes.
I work with him.
So, one of the other benefits, and I'm hoping that eventually we get like this for all women, is, when you're a physician and you're going through something like this, then other physicians are going to step up and say, this is who I would send my mother to. This is who I would send. So Dr. Berry and my plastic surgeon, Dr. Chandler, were all like, recommended, just because of what I did and what my ex-husband did. But Dr. Berry was so funny. I have to tell this story, and then I promise you I'll give you my So at this point, I've gotten the diagnosis. I'm working at the health department. My husband's in there, my mom's in there, and Dr. Berry starts on his spiel because, like she said, they have to give you all the options, right? And so you all can imagine what my face looked like because I had already decided what I was doing, right? And so he stops and he said, Michelle, he was like, please let me do my job. I have to tell you all of these options. And I was like, I haven't said anything. I'm just giving you looks. But I haven't said anything. Right. I haven't said anything. So I let him go through his spiel. And of course, he probably did it differently just because of who he had sitting in the room. But he basically told me the options and then told me the percentage of people who recurred, the survival rates based on the options. And even after I heard all of that, the best option for me, given my family history, what I knew about breast cancer in my family, and the survival rates and the recurrence rates, the best option for me was a double mastectomy with reconstruction. Now, I only had breast cancer on the right, but the thing that really got me and really scared me was that the year before, because I told you my mom had been diagnosed 3 years before, and so the year before I'd had a totally normal mammogram, age 39, and it was quick. I was working in the health department then. I went up to the diagnostic center. They did my mammogram within 10 minutes. I was out the door. I was back at work. It couldn't be any quicker. It was totally normal a year before. And then just 1 year later, I had 2 invasive spots on the right. And when they finally put me on the operating table, I had 2 positive lymph nodes. So I wasn't stage 0 like my mom. I was stage 2A. Within 1 year. So early detection will save your life. If I had delayed even a couple of months, and I couldn't feel anything, like I did my self-breast exams, I did it all, right? I couldn't feel anything. I couldn't feel those 2 spots. And so even if I had delayed another couple of months, it could have meant my life. It could have meant that I could not be around to raise my children and to do all of the things that I've been able to do since then. So it really does make a difference.
Thank you for that, I think, urgent call for early detection. I also heard you talk, obviously, about your family history. How does family history affect the frequency or the age in which you need to start screening?
So based on your family history will determine, so for instance, if you have a mother or a grandmother that was diagnosed at age 60, they may recommend you start getting screened. Of course, you're going to be screened at 40 anyway. So for that patient, it may not make a difference. But if you have a 40 or 50-year-old mom, they may say, if your mom was diagnosed at 50, you probably need to start getting, some of them are saying 15 years prior to. to start getting screened. So that means maybe at 35, you may start getting screened. And then based on your family history determines whether or not is a screening enough. Do you need to see a high-risk specialist, meaning they have high-risk breast specialists that just do like genetic counseling, and they counsel those that are at greater risk for cancer for preparation in the event that it happens. And they may send someone that has a strong family history to that specialist just for keeping a close eye on them. So family history plays a big role. When you're screened based on the circumstances, how many relatives in your family that have breast cancer determines when you're screened. So it's an algorithm per se when you're looking at it, because it may not be breast cancer. It could be what age the person was diagnosed, or how many relatives on one side of the family, or did they have another cancer in conjunction with breast cancer. So it can get very complicated when you're talking about family history and screenings and referrals and high risk and all that, but that's what your provider is for. If you have a history or family history of breast cancer, ovarian cancer, cervical cancer, you need to talk to your healthcare professional about that so they can guide you in the direction you need to go. You don't need to say, oh, well, it was just cervical cancer, I'll be fine. Because it's not the case.
And you talked a little bit, I think, about, the risks. Are there ways that we can reduce our risk of breast cancer?
You want me to start?
Well, one thing you can't do is you can't fight genetics. So the biggest thing is family history and your genetics and what your genetic makeup is. Of course, diet plays a role in everything in our body, and it can lead to certain types of cancer. But 100% preventing breast cancer when it comes to risk.
Right, and we wish it did exist, because then we could, take the magic pill, do the magic thing, and prevent it, right? But there is no cut and dry thing to prevent breast cancer. And going back to the family history thing, even though I had a strong family history of breast cancer, when we did the genetic screening, so my mom did the genetic screening twice. I did it once, because she did it once when she was diagnosed, none of the genes that we know about. She did it again when I went through it. I didn't have any recognized genes for breast cancer, and neither did she. So what the geneticist said was, listen, given your family history, because we have a lot of cancer in our family, not just breast cancer. The youngest person in our family who has died was 3. He was treated at St. Jude. So we dealt with this in our family. And what the geneticist said is that the human genome is just so vast that whatever is causing cancers in our family may not be discovered yet. It may not be detectable yet, and they're always adding to that panel. So when my mom went through, they had like 24 genes that they were looking for. By the time I went through just a couple of years later, they had 40, but we did not pop positive for any of those. And so keep that in mind too. But do the things that you know you're supposed to be doing. We know we're supposed to be eating well. We know we're supposed to be moving. We know that extra weight, particularly around the abdomen, can, make you more susceptible to all kinds of chronic illnesses and cancer. And so those are the things. And then the other thing I like to tell audiences when I tell my story, and I know you see this a lot, stress. So even though some of you all see me and you see like, oh man, she's tough all the time. Like, she just no nonsense, just gonna tell you how it is. Some of that is just what I've been through, but some of it is, when you're faced with your own mortality, you just the stupid stuff and the small stuff, it just doesn't matter. What matters to me is being able to do what I've been put on this earth to do and carry out my purpose and to raise my kids and to have some fun in between. And while I'm carrying out that purpose and raising my kids and doing all of the other things, and all the other little small stuff, it just doesn't matter as much. I'll never be able to prove it. I will tell you that I was at a different place in my life before I got diagnosed. And I was at a high stress point. Job, family, marriage, all of those things. And I've said this before, so this is nothing new. You know, I'm very transparent. If I had to go back, if I could really look, I would say that stress played a huge part in me developing breast cancer. And nobody can convince me any different. A lot of us, particularly women, you know, I'm talking to the women in the room now, we tend to take care of everybody else before we take care of ourselves. We take care of everybody at work, we take care of everybody at home, we take care of everybody out on the street if they look like they need something. We're just gonna do that, you know. But if you're not taking care of yourself, then eventually that's gonna catch up. So a lot of times I talk to people all the time when I can tell that they're stressed, when I can tell that they're at the limit, and I tell them two things. One, you cannot pour into anybody else from an empty cup. That's my church upbringing. You can't do it. You can do it for so long, but eventually that's gonna run out. And two, if you don't listen to your body and sit down somewhere and start taking care of yourself, your body will sit you down. There are people in this room who saw me the day I found out I had breast cancer. I got my diagnosis at work on the 3rd floor of the old Shelby County Health Department building. I was at work. Even though I knew I had had a biopsy, I went to work that night after the biopsy. You cannot pour from an empty cup. Stop doing it, because eventually your body is going to take over and you're not going to like what happens next. And it's a long road back. You can come back from it, but it's easier if you start taking care of yourself now. Self-care is so very important. If nothing else gets through today, I hope that gets through.
Thank you. I think we're hearing self-care and early detection as the main takeaways. And just to end on a positive note too, before we all get our self-care cupcakes over
Yes.
here, that was so delicious. What would you say is the most exciting thing in breast cancer research right now that's really affecting outcomes right now in a way that you know, other patients in your family even didn't have one?
The treatment options.
Yeah.
The treatment options, the medications, how chemo has changed, like the autonomy patients have with their choices, like it's my body, my choice. I don't want to do that. I can do this. Maybe I'll try that if this doesn't work. So there are a lot of options. Medicine has changed so much where there isn't 3 chemo drugs anymore. You know, so there are a plethora of drugs and there are all these combinations of treatments that patients can do. And depending on what the patient has going on, sometimes they don't even have to have surgery is what I have seen, you know, if their mass shrinks significantly. So just to know that we are in a place where innovation is saving lives and it's not costing people their life, you know what I mean? Because some people, at one point, people were getting chemo, and I know you all have heard that chemo kills people. Because that's what people tell you, but chemo has changed so much that that's not the outcome anymore. Like all of the adverse effects that come along with it, you're not experiencing it anymore. So I would say that's the best thing in this breast cancer and cancer realm right now, that treatment is changing. Everything is evolving.
Thank you both so much for your words of wisdom and sharing your experiences. Thank you again to the innovation team and to the mayor for bringing us here. I will turn it over now to Director Hines.
Give these ladies another round of applause.
so much for giving us your time, for sharing your stories and your experience, your perspectives. Very, very different perspectives. I found myself getting emotional listening to some of those stories, Dr. Taylor. Just awesome. But thank y'all so much. Y'all, my best friend from college, her name is Whitney Grove, and she's 34 years old, and she's currently in year 2 of what she calls thriving with breast cancer. On the same day that she was offered her dream job, and on the same day that she signed the paperwork to close on her dream house, she received the call. And what Whitney would say is, y'all, what are the odds? 1 out of every 8 women will receive that call. And 8 out of every 9 will have no family history of breast cancer. Some of the very people sitting in this room have received that call. And while some continue to privately navigate their personal health, others have fallen along the spectrum of celebrating their victory and continuing to spread awareness about this comparable disease. Whether quietly grateful or loud and proud, we call these women warriors. And today, with permission, we will honor 6 of the women who are right here in this room. Mayor Harris will present each one with a plant, a ZZ plant, originally from East Africa. This plant represents their tenacious, audacious, bright and bold exterior and unapologetic peace, which you just heard Dr. Taylor talk about. Y'all, plants are delicate. Wind, rain, sun, and even pests might try to destroy them, but plants persevere. The ZZ plant especially perseveres. It's considered one of the hardiest houseplants. So if you receive one today, you do not have to be afraid. They are a true warrior in their own right. And thanks to the partnership of locally owned Golden Hour, which is right down the street, each one of our warriors will be taking one home today. So Mayor Harris, would you please join me up here? As I call each warrior's name, please offer her a round of applause as she approaches the front of the room. She'll then return to her seat, and I'll call the next name. So let's not make it too awkward for anybody, okay? First up from Community Services, please welcome Ms. Yolanda Rose.
Congratulations, warrior.
Also from Community Services, we have Ms. Tawana Tolliver. One more from Community Services. Y'all don't cry, y'all gonna make me cry. Miss LaQuisha Jefferson. From the Public Defender's Office, Miss Charla Johnson. From our Division of Planning and Development, Miss Brenda Gibson. And before I do our last one, I just want us to have a moment where we honor a couple who are in this room right? But we're gonna take a moment and we're gonna honor them with applause. And last but not least, Dr. Michelle Taylor. That's all, y'all. Thank you so much. Can we get our warriors to join us in the conference room right across the hall for those in your hair? Everyone else, make sure you grab some cupcakes and some snacks before we get the word. Thank y'all so much for coming.